Okay, I don't think this one's, oh, look, that's what it's supposed to look like. See that black dot? That's a good sign. Okay, so back to what we were saying. So anatomy is not outrageously intellectually difficult to understand, but it is really overwhelming with the content, the amount of information, right? Not the complexity of the information all the time, but the amount of information. And then, of course, it's not even in a language that you're familiar with. It's primarily in Latin and Greek. And Latin and Greek is used pretty consistently because ancient Greek and Latin are not languages that are evolving, so that the meanings are changing dramatically. It's also really consistent so that, for instance, if a Japanese researcher wanted to communicate with an American doctor about a new technique, right? They all use the same set of terminology, and it means the same thing, and it has. So it's really consistent terminology. Unfortunately, it's not necessarily in a language that you were familiar with. However, if you speak Spanish or Italian or French, some of the Latin-based languages, a lot of these roots will be familiar to you. And so you get a little benefit from being bilingual, which is nice. Okay, so if you speak a language that is rooted in Latin, then a lot of times this will actually help you because, for instance, a lot of the words have familiar roots. So what I'm going to do for you is the first thing is your very first assignment, which has already been on melanieb.com. Maybe you saw it, maybe you didn't, was right here. Under assignments and announcements, it says a list of useful prefixes, roots, and suffixes. So what I'm going to do is encourage you guys to learn a subset of the Latin and Greek roots that you are going to be using very frequently. Does that make sense? And then the idea here is that if I'm reading in my textbook and I come upon the word hematocytoblast, which isn't a word that most people have ever run into unless they've taken anatomy. But what I don't want is for you to stop cold, either stop reading because you're frustrated or have to look up every damn thing in the glossary all the time. What you need to do is to be able to figure out the meaning of new words by context, okay? And so even though you don't know necessarily what hematocytoblast means, you may know what hemato means. Does anybody know? Blood. And you know what cyte means, right? That means cell. And blast, does anybody know what blast means? Precursor or bud. So it wouldn't surprise you at all that within the context of what you're reading, which is you're reading about the bone marrow, this is a blood cell precursor. These are the cells in the bone marrow that make blood cells, right? So what we want here is we want for you to be able to pick out the probable meaning of unfamiliar words based on these familiar roots. And how does this help you? So if, for instance, you were the person who studied roots, you would know, and this one's an easy one, that if I was looking for the supraglenoid tubercle versus the infraglenoid tubercle, where would I look for them with reference to the glenoid cavity? The supraglenoid I would probably look for above. And the infraglenoid I would look for below. Okay, so this stuff you are going to be using all semester. And you're going to be using it because, for instance, if you know that brachiocephalic, you're looking for the brachiocephalic vein, and you know that brachio means arm and cephalic means head, you're looking for a vein that's between here and here. You're not going to be rummaging around down here looking for it, right? So what you do is it gives you a prediction of what would probably be true, which then you can confirm or refine if you were wrong, okay? So you need to know these prefixes, roots, and suffixes. What I'm going to do is not ask you rote memorization of these, but I am going to either make a new word or use a new anatomical term that most of you haven't run into yet from these and ask you what you think it means. Not rote memorization, logic, right? Okay, that makes sense? So I might ask you, where would you look for the infraglenoid tubercle with reference to the glenoid cavity and give you some choices, right? Okay, so there's going to be a few of those questions on your first quiz. Okay, so you're going to be running through those. All right, so that first quiz will be that plus everything else that we covered today, okay, which is not going to be a vast sum of information. And most of you, the stuff that we've done today is the stuff that you did last week in lab. So I really hope that you've been studying. Those of you who will be at a slight disadvantage are those of you who took Monday lab, because you haven't covered this yet. for the future, never ever take a Monday lab ever in your life, because they always smash the material together and you never get to take any of the material off, okay? All right, so how do we approach anatomy in here? There's a bunch of different ways to approach anatomy. Anatomy is the study of the structure of the human body, and anat means to cut, because quite often you can't see much without cutting it. Anatomy is also sometimes called morphology. Does anybody know what the prefix morpho means, or morph? Shape or structure? Yeah, it means shape or structure. So the way that we approach anatomy is there's two big categories of anatomy. There's microscopic anatomy, and microscopic anatomy includes cytology, which is the study of cells, but we don't really do very much of that because you had all of 1610, which was cells, right? And then histology, which is the study of tissues, right? So we kind of start at the histology level. Histology is study of tissues, and you know this from 7th grade, where you learned that tissues are cells functioning together. But we'll figure out that there's actually a more complex and truer definition of histology as we get into it. That's where we'll start. And then right after that, we're going to move to the other part of anatomy, which is gross anatomy or macroscopic anatomy. It's not called gross because it smells bad. It's kind of squishy, although that's often true. Gross means visible with the unaided or the naked eye. And so that usually starts at the organ level, because although you can't see cardiac muscle tissue, you can certainly see a heart, right? So you can see most organs with the unaided eye. So it usually involves dissection because you can't see very much without cutting into stuff. And you guys are going to do some dissection. This semester you will do a bone, you will do a cow eye, a pig heart, and a sheep brain. The rest of the dissection, the human dissection, we'll do for you because it's really freaking hard. And it takes a lot of skill, and we don't have just a whole bunch of extra people for you guys to practice on. Okay, now, there's two different approaches to anatomy that are very commonly used to teach it. We use this one. Systemic anatomy, like I told you guys last time. The first body system we'll get into is the skeletal system, and we'll look at it as a system, not just individual bones, but like how does it hang together as a body system. And then the idea with systemic anatomy is if you teach a body system, when you see the anatomy, you start thinking about the physiology when you look at it as a whole system, right? You don't necessarily know all the physiology, but you start thinking, oh, if the heart is actually attached with this large tube and then here, you start thinking about flow, right? So we do systems, we do skeletal and then muscular layered on top. Hopefully you start seeing how those two might interact. Then we layer another system over it. The idea with this one is that this anatomy is a really good structure-function relationship that gets you ready for physiology, right? Now, there's a different approach that you can do to anatomy, which is regional anatomy. We talked about this a little bit last time. With regional anatomy, which is usually how you would take anatomy if you get into med school or PT school or PA school, and a little bit of nursing, although they approach it slightly differently. With regional anatomy, instead of doing systemic, in which you look at the whole thing and start figuring out structure-function relationships, they would, for instance, focus on the upper limb. So you would have a lab that was upper limb anatomy, and you would learn all of the muscles, nerves, or vessels, connective tissue, skeletal components of the upper limb. You can see how that would be more relevant to a physical therapist, yes, than just systemic anatomy. But the problem is that you're probably not ready for that unless you've had a systemic anatomy course, right? Does that make sense? So it's really focused on like just regions. Now, their undergraduate anatomy, taught by Mark Nielsen, he's a colleague of mine, he does regional anatomy at the undergrad level. So they do it from the undergrad. It's the only school that I know of that does it, regional there. And it's a different course, but it's a good course too. Okay, there are other branches of anatomy too. Surface anatomy, nurses get really good at this. I'm terrible at it. Because if I want to see what's under something, I just cut it open because I deal with dead people, okay? But with surface anatomy, with you, if I wanted to listen to your heart, I were a physician or a nurse, then what I do is I know that anatomically I can use external landmarks to learn where internal things are. So the heart comes into contact with the anterior wall of the thoracic cavity between ribs 3 and 4, just left of the clavicle. right? So your doctor's rooting around in there, moving up your boob if you got boobs, right? Okay, making everybody uncomfortable. But that's the surface anatomy. For instance, if you wanted to do an epidural injection, you want to count down below L3 or L4 because that's where your spinal cord ends. So you use the surface anatomy to count. If you want to know where your urinary bladder is, it's in your pelvic cavity, which is below. Draw a straight line between your anterior superior iliac spines, these things that you can still feel if you're young and thin enough to feel them. Draw a straight line, and then below there is your pelvic cavity. So you use these external landmarks. I don't use those because I just cut it open if I want to see it. But embryology and developmental anatomy are related to one another. This is how basically you get from a cell through the embryonic stages, and then this is how you get up to the entire adult human that you are. And then we do a little teeny bit of this just because it's interesting. Pathological anatomy. Most times pathologies are phys problems, they're just functional problems. But like scoliosis, isn't that a pathological anatomy problem? Or a cleft palate, right? Does that make sense? So we'll throw in a few of those every once in a while. It's not my area of expertise, but it's kind of interesting stuff. Okay, so if I do it right, then what happens is the anatomy that I present to you starts making you think about the physiology. And I always sprinkle phys into anatomy because it is dry as a freaking bone if you don't. So the first semester that I taught in Utah, in Texas where I taught before, A and P go together. There's an anatomy and physiology one, and then there's a second section. So for instance, you do cardiovascular, like all the heart structures, and then function at the same time. But in Utah, they do them separate. So the first semester that I taught here and I just did anatomy by itself, I was like, I am putting myself to sleep while I'm talking. So then I changed the way that I taught it so that it's got enough physiology to keep me interested. And you think it's about you, but I have to entertain myself because I have to do this for 3 hours straight. Okay, so physiology is the study of function. I teach phys too. Okay, so I try specifically, like when I know you need something in phys, I really make sure you get it in anatomy. Okay, so let's start with an introduction to gross anatomy. You should have done most of this in lab, but let's make sure that you have the opportunity to refine it if you didn't think you got it in lab. Okay, so we're going to start first by saying that here's the thing with anatomy, that Japanese researcher and the American doctor need to be using the same language and the same assumptions, or else you're going to have to reinvent the wheel every single time, right? You need to be able to, without pointing to something, you need to be able to communicate in the written language. So there's a set of assumptions or expectations that everybody in the medical sciences has. And the first one is that when I'm talking about humans, I have an assumption of the body position. Regardless of whether I am like this, anatomic position refers to humans always in the same position. So sometimes you just need to imagine that they're in anatomic position. Anatomic position in humans is standing up, palms forward. Hold on just a second. I accidentally closed everything when I was trying to get the recording working. So, anatomic position in humans is feet on the floor, palms forward. Not because this is the most comfortable position or even the most natural. If I stand comfortably, I don't do that, right? I either do that or that. Talk about why it's like that in just a second. So this is anatomical position in humans, okay? If you're standing up, that it matters because that means that the structures right here on my anterior forearm right here are anterior structures that correspond to my belly side. No matter where I am, this is still an anterior structure. So my assumption when I'm talking from me to you is if I'm talking about somebody that, for instance, has a skin cancer lesion, and I say it's on the back side or the posterior side of their forearm, posterior is always there, right? Even if the person is facing me, even if their arms are up here, right? So that's always a posterior structure. So this is anatomical position, okay? And, but your patients are not always standing up, right? Sometimes they're laying down. So what is anatomical position laying down? Anatomical position laying down, there are two. It's still with the arms in the same position, but it can either be laying face up or face down, depending on what you're trying to get to. So anatomical position like this, face up, is called supine. okay? Anatomical position like this, face down, is called prone, okay? I remember this from 7th grade because if you're supine, you can drink soup, and if you're prone, you pull it out. In Texas, it makes sense. If you were a redneck child, it made total sense. Okay, all right, so supine and prone. Okay, so, but regardless of the person's position, that means that my expectation when I'm communicating from me to you is always that they are referring to the person as if they were in anatomical position, right? So I don't care where their arms are, this is still an anterior portion of their forearm. Okay, all right, so now why? Why is this uncomfortable, slightly unnatural position considered the anatomical position? It is because we are mammals that happen to be bipedal, but that is the exception, not the rule for mammals, right? Most mammals are quadrupeds, yeah? Your cat, your dog, my dog. So, you are amazing, your mom thinks you're special, but you're just a freaking mammal and you got the same parts as your dog, okay? The same parts in the same places. So, if the vast majority of mammals are quadrupeds, right, let me ask you what side of their body, belly side or back side, this part of their forelimb corresponds to. Belly side, right? Does that make sense? So with your cat and your dog, the muscles that I find that correspond with their belly side are the muscles that in humans correspond with the belly side if you use anatomical position. Does that make sense? So otherwise, we would have to say, okay, in humans, it's a posterior structure, but in everything else, it's an anterior structure. And that would make comparative anatomists go bonkers because we think we're so damn special, okay? So really, anatomical position in humans should be like this, but that takes up a lot of room in textbooks. Okay? So this is an anterior structure. Good? Okay. So now the other thing is because we are not just bipedal organisms, we are also bilaterally symmetrical. We have like an imaginary midline, and on either side of the midline we have mirror images, right? Paired structures. Because we are those kind of critters and not like a starfish or something. We have left and rights to refer to, right? So since we have paired structures, and you can imagine an imaginary midline in a human, whenever you have a paired structure, now you have an extra responsibility. Because in anatomy, this is not my eye, this is my right eye, okay? So left and right, you always refer to who's left and right. Well, it's not about you when you're in the medical professions, right? Stop being a narcissist and empathize with the patient. I'm concerned with her left, right? Not my left. So even if you have to flip yourself around to figure out which side you're looking at, do it. Everybody has to do it. And in anatomy, nobody's looking at you anyway, right? They're like just trying to get through the damn thing. Okay, so left and right, always refer to the specimen, the cadaver, the organ that you're looking at. Never to you, never to the viewers left and right. And now I need to tell you something. I'm going to say that for any paired structure for the rest of the semester, if you leave off left and right, I reserve the right to count the whole thing wrong. So if you put lung and the answer was left lung, it's not partially right, it's wrong. How many times will I have to do that before you figure that out? No. No. Just usually once. I don't usually even do it all semester long. I just ding you once or twice and then you figure it out. Why does this matter so much? It matters so much because have you guys read the articles or seen the news blurbs in which somebody got the wrong damn kidney taken out? The wrong eyeball, the wrong knee operated on? Where does that start? It starts here. It starts here with the habits that you get in undergraduate anatomy. So let's work on those habits at low stakes instead of at high stakes. I like all of my paired structures. And you guys are going to be taking care of me as all my stuff stops working, right? So, all right. So now we'll talk about directional and regional terms. You guys ready? Okay. So with directional and regional terms, what we are talking about is pairs of terms that introduce how you refer to two things with reference to one another. So let's talk about this. So again, the assumption is always that I'm in anatomical position, right? And some of these terms are completely familiar because you've been a human who can read for a long time. And some of them are less familiar because they're specific to anatomy. Now, superior and inferior is not going to surprise any of you guys, right? So if I were in an anatomical position, which is always the assumption, and I said, My chin is what to my navel? It's superior, right? My pubic bone is what to my navel? Inferior, right? So superior and inferior are obvious, right? However, they are not broadly applicable between organisms, because now let's talk about the cat. Does superior and inferior work for the chin, the navel, and the pubic bone for the cat? They don't. So sometimes instead of that pair, you will use the next pair, which is consistent among all organisms, and that's called cranial and caudal. And cranial and caudal means more toward the head, right? And caudal means more toward the tail, okay? If you fish, this is the caudal fin, okay? So let's do it again. Same thing, but use this pair now, okay? My chin is what to my navel? Cranial. And my pubic bone is what to my navel? Caudal. Does that make sense? So which one are they going to use? Yes. Whichever one they want, right? Whichever pair. In these two pairs, superior and inferior is more common, but cranial and caudal, you need to know what it means when you run into it, okay? All right, so now let's do the next pair, the next two pairs. The next two pairs are anterior and posterior, freaking obvious, right? Okay, so if we're talking about anterior and posterior, let's do my navel and my coccyx, okay? My navel is what to my coccyx? Anterior. My coccyx is what to my navel? Posterior. Got it? Okay, but that doesn't work if you're a cat, does it? That's not the relationship of those two. Does that make sense to you? It's not anterior and posterior. I guess it is a little bit, but not quite. This one's on the bottom and that's on the back. Okay? So what is something that is consistent to use among all organisms? And that is the next pair of terms, which is ventral, which means belly side, and dorsal, which means backside. Okay? If you fish, this is the dorsal fin. Or she said last time, something I had never heard before, don't let the door hit you where the good Lord split you. I said the last part. She didn't say that part. That's a Texasism. Figured out they don't have as many swearing things that are just charming in Utah. So I'm bringing them to you. You are welcome. Okay. Okay. So ventral is belly side. Dorsal is backside. So now let's name some structures we haven't done before. My eyes are a what structure? Ventral, right? With that pair. My coccyx is a what structure? Dorsal, okay? My chin is a what structure? Ventral. Now, you will see dorsal and ventral used at least as often as anterior and posterior. It's used all the time in your textbook. So for instance, you might come into a picture of the muscles of the forearm. These are hard. I call them the damn forearm muscles because I can't remember the damn things any damn semester. Okay, so these are the damn forearm muscles. If it's skinned, you would be amazed at how hard it is to tell the front side from the back side. So in order to know what you're looking at, you look at the legend on the picture, and it says human left antebrachium, forearm, okay, comma, ventral view. Tells you exactly what you're looking for, right? So this terminology will be used all semester long, and it's really good to get comfortable with it earlier. So anterior, posterior, ventral, and dorsal, they're not synonymous with anterior and posterior in all animals. It's positional. That's why the second ones are sometimes more frequently used. Okay, medial, lateral, and intermediate. These are not hard. Okay, since we are bilaterally symmetrical, we have an imaginary midline that everybody can figure out where it is. Everything on either side is almost paired, not internally, but externally almost paired, right? And if you are closer to the midline, you're called medial. If you are further away, you're called lateral. Does that make sense? So let's talk about this. My nose is what to my ears? Medial. My ears are what to my nose? Lateral. Anatomical position, I'm not going to show you. You're going to tell me this time. My thumbs are what structures? Medial or lateral? Lateral structures. Yes? Anatomical position. Okay. So you can have a medial surface of the forearm, a lateral surface of the forearm. You can have the medial thigh muscles, the lateral thigh muscles, the ventral thigh muscles, and the dorsal thigh muscles. Right? Is that good? Okay. So medial, lateral. You can also have an intermediate. So I've got an appendix scar right here. Okay. Appendix scar, navel, ilium, which is this bone right here. Okay. So I can describe these three with reference to one another. The navel is what to both other structures? Medial. The ilium is what to both other structures? Lateral. And the scar is what? Intermediate between the two. Good? Okay. Medial, lateral, and intermediate. Proximal and distal. This is the hardest one for people. This is the one you need to take notes on if you haven't taken notes on anything else. Okay. Proximal and distal are used in a special circumstance. They are only used for long, skinny things like limbs or tubes. So limbs or tubes. Okay? So wouldn't be used on the torso, would be used on the small intestine or any blood vessel, would be used on the limbs. So let's look at them. Proximal and distal describe things along the length of a limb or tube with reference to the point of attachment. Okay? So this is the natural inherent point of attachment for the upper limb, right? The shoulder. And this is it for the lower limb. Sometimes you have to specify when you're inside because there's more than one point of attachment. So let's do the easy ones first. Okay. Proximal means closer to the point of attachment. Distal means further distant from or further away from the point of attachment. Okay. So let's do these. My wrist is what to my elbow? Distal. Distal to my elbow. My shoulder is what to my elbow? Proximal to my elbow, right? Okay. The most distal structure on my upper limbs is what? The digits, right? Does that make sense? Okay. So proximal and distal. Now, let me tell you about proximal and distal. Internally, if I'm doing the small intestine, it's got 2 points of attachment. So sometimes I have to specify which one I'm talking about. Okay. So the small intestine goes from the stomach to the large intestine. It's got a sphincter on either side, right? So why would I use these? The reason I use these is because the limbs or tubes are not in the same place as you and me. I mean, they don't curve exactly the same, right? And then if you eat dinner, it's not going to be the same curve as it was the last time you visited the doctor. So let's say you had a blockage or a lesion that they thought might be cancerous, that they found on some kind of scanning. Do you want to put down on the forearm where it is superior, inferior, medial, and lateral? No, because it's not going to be in the same place. But isn't it going to be in the same place with reference to the point of attachment? So if you followed the tube, yeah? So instead of saying where it was superior, inferior, lateral, and medial in the body cavity, you would say it's 10 centimeters distal from the pyloric sphincter, for instance, right? And you've got a lot of limbs or tubes, right? On the inside, you've got lots and lots of tubes, so you see that used very frequently. Now I need to tell you that that means that it is wrong to use superior and inferior or cranial and caudal on limbs or tubes. So if I gave you these two structures on a quiz or a test and said the elbow is blank to the wrist, and I gave you superior, and I gave you cranial, and I gave you proximal, only one of those is correct. Does that make sense? You do not use superior and inferior. You do not use cranial and caudal on limbs or tubes. You always use proximal and distal. Now, can you use lateral and medial? Yeah, because that's not along the length. Okay? Can you use anterior and posterior and dorsal and ventral? Yeah, because that's not along the length. Just along the length of a limb or tube. Okay? Does that make sense? Okay, go ahead.
So when you're specifying, with the proximal and distal, is that always from the point of attachment?
It's from the point of attachment. Right here, you only have this point of attachment. If the point of attachment is not obvious, then you would need to clarify, right? With the limbs, you don't need to, right? We can always all figure out where they're attached. But with almost every other damn thing you do, okay? All right, so last one, last pair is superficial and deep. And superficial and deep is really easy if you just think about wounds or personalities, right? So you got superficial and deep. Let's talk about it. So imagine yourself as a spherical skin-shaped ball. And imagine that somebody is making a slice. If it only gets through the skin, then it is a what incision? Superficial or deep? If it goes all the way through, it's pretty damn deep incision, right? Does that make sense? So with superficial and deep, of course it's for incision, but it's also for layers, right? Lots and lots of things are layered in the body. And how do you find them? Well, first of all, you need to know whether you're looking at the superficial musculature of the anterior forearm, or you're looking at the deep musculature of the anterior forearm. So let's see if you guys can practice those just a little bit. So if I'm talking about layering, I can use superficial and deep. So let's talk about my skin with reference to my muscles. My skin is what? Superficial to my muscles. And my bone is what to my muscles? Deep to my muscles. Good? Okay? Or sometimes you can have multiple things that are layered that you may or might not yet know yet. When you get into the abdominal muscles, there's at least 3 layers out here, and then sometimes there's a 4th one that has greater and lesser degrees of layering. So how do you figure out the abdominal muscles? We're going to have to be the person who knows that the first one you see, the most superficial one, is going to be the external abdominal oblique. And you can't find the internal abdominal oblique until you go deep to it. And you can't find the transversus abdominis until you go deep to that. So you can describe them with reference to one another, right? The most superficial muscle in the lateral abdomen is the external abdominal oblique, and the deepest muscle in the lateral abdomen is the transversus abdominis. That makes sense? Okay, so when things are layered, you have to read to know, right, where the layering occurs. Like, I'm telling you this because just going in cold and looking at a picture and trying to find it sometimes is not good enough, because you actually need to know what your expectation is. Like, if I'm going to go look at the muscles of the thigh, they're hard, right? Not as hard as these, but they're hard. I need to know what's going to be on the outside layer, what's going to be deep to what's going to be superficial to what, and then go look and confirm it. And a lot of that you can't glean from a picture, right? You can't see all of the layers of anything from one picture. Okay, so those are your directional terms, orientation and directional terms. And then let's talk about the regional terms. The regional terms are the same ones you're learning in lab. And the ones that you are learning in lab are all of this terminology that says that basically every part of the body has a specific anatomical term that goes with it. You don't have to know all of them, but these are the ones you're going to run into all the time this semester. So why on earth am I dumping all of this vocabulary on you? Because if you will take the time to knock this out at the beginning of the semester, you're going to be more successful for the rest of the semester. And the reason is that although it seems right now completely irrelevant to anything, that the anterior portion of the elbow is called the antecubital region, it will become absolutely relevant later when you're looking for the median antecubital vein, which is one of the most common sites of blood draw, which is right here. Because these words refer to structures that you are going to be finding all the time. You are going to be, for instance, looking for the popliteal vein or the popliteal nerve where? Where would you look for it? Back of the knee. Yeah. Okay. So if you will engage in this process with me and learn the prefixes, roots, and suffixes in this terminology now, then what you do is you go in to every new term with a prediction of where you think you're going to find it. And then again, you can just confirm your prediction or refine your prediction if it was incorrect. Okay? So you are going to need to know all of these things. And some of them are obvious. It's not going to surprise anybody that buttock is gluteal, right? But you probably didn't know, for instance, that popliteal was the back of the knee until you took this class, or that crural was the word for the front of the lower leg. Okay? But you will. Okay? And this will be useful for you. It's not just random rote memorization. It will actually help you for the rest of the semester. Okay, so figure 1-8, A and B, all of that terminology is the same as stuff that's in your lab book, guys. It's the same, okay? And there's also a table for those of you who are more table people than figure people. You can look at this table as well. Okay, so you're responsible for that. Okay, and then this general terminology I just have to introduce you to because this is not a name for a specific part of the body, but it's a name for like a big region of the body, and you're going to run into these all semester long as well. Axial is the term that refers to any structure that correlates to the long axis of the body. And if you had a long axis to the body, imagine that you took an eye bolt and screwed it into your head and hung yourself from the ceiling. There's a certain place that you could put the eye bolt that would make you hang relatively straight, right? Okay, that is the long axis of the body, okay? And axial refers to anything associated with the long axis of the body. So for instance, your axial skeleton would probably include your cranial bones and your facial bones and your vertebra. Yeah? That makes sense? And anything directly attached to your vertebra like this. Good? So that's axial. Appendicular has to do with your appendages. Yeah? So when you guys start skeletal system, which you'll start next week, you are going to do 2 weeks of skeletal system. The first week will be axial skeleton, in which you're going to spend the vast majority of your time studying the skull. And then everything else is easier than the skull that week, right? Because you got ribs, you got sternum, right? You've got vertebra, but everything else is easier than skull, okay? So that's the axial skeleton. And the next week you're going to do appendicular skeleton, in which you study all of the other bones. Now, the only counterintuitive thing about the appendicular skeleton is that the clavicles and the scapula are part of the appendicular skeleton, not axial, because they're only there to hold on to your arms. Same thing with the pelvic girdle. You don't need hip bones if you don't have legs. So those actually go with the appendicular skeletons. Okay, go ahead.
You said clavicle.
Scapula. Yeah. And then, so you're going to do 2 weeks of skeleton, axial, appendicular. You're going to do 2 weeks of muscle. We actually do appendicular first because it's harder and you do 2 weeks to study it. So you do appendicular muscles and then axial muscles, right? And then after those 4 weeks, you get your practicals. Cool? So that's what axial and appendicular has to do with. All right, so, okay, let's change gears for just a second and talk about body planes and sections. Okay, so you can't see everything from the outside, so a lot of times you have to slice, and there are names for the specific types of slices that you make, okay? So let's talk about that. So if I were going to make a slice through an organ or through a body, what I wanted to imagine is instead of slicing with a knife, I sliced with something like a plane, like a big flat plane of glass. So for instance, if I decided I wanted to see what she looked like right there, you use a plane, okay, to make a section. And if I cut right there, what I'm interested in is not this view, I'm interested in the cut edges, right? Okay, so you use a plane to view a section. Yes? You use a plane so that you can see the section, and you cut where you want to look at it, right? Okay, so we're going to look at the types of planes and the types of sections. So here is the relationship. We have 2 big categories of planes. We have longitudinal planes. Longitudinal planes are the ones that run parallel to that imaginary long axis. So this would be a longitudinal plane, yeah? Goes parallel. But so would this, wouldn't it? Because 2 different planes can be parallel to a line, right? Okay, so this is a longitudinal plane or a vertical plane, and this is as well, okay? And then this is perpendicular to the long axis, and this is called a horizontal plane or a transverse plane, sometimes called sometimes creates a cross section. Good? Okay, so let's go back to the longitudinal ones and do those first, and then we'll talk about the transverse ones and then the other one that's kind of an accident. Okay, planes and sections. Vertical or longitudinal planes of sections. So let's talk about the first one. The frontal or coronal plane is the one that you're seeing right here. The frontal or coronal plane is the one that goes this direction. So on me, it would go right here, or here, or here, or here. It divides the body or the organ into what and what parts? Anterior, posterior, or use a different pair. Ventral and dorsal. Yeah. Okay. All right. So that's a coronal. Corona, like the crown, right? Or the beard. That's a corona. Imagine like a tiara or corona. Yeah. Coronal, also called frontal. Why would you use that plane of section? Well, if I wanted to see a section that sliced through both lungs and the heart, that would be a really good section to use, right? Okay. A coronal or frontal. Okay. The next one is a sagittal one. Sagittal. This is a really commonly misspelled word. It's 1 G, 2 T's. Sagittal plane produces a sagittal section. And the sagittal plane does this. Okay? And it divides the body into what and what parts? Right and left. Okay? But since I have an imaginary midline, I can have a mid-sagittal section or a distinctly not mid-sagittal section like this. It's called a parasagittal section. Okay, so let's distinguish for a second. You ready? Okay, so both of these are sagittal sections. This one is mid-sagittal. Yes? This one is parasagittal, which means unequal left and right parts. Okay. Notice when I said coronal, I didn't have a mid-coronal because I don't actually have a midline there. Yeah? But I do have a mid-sagittal. Okay, so let me again reinforce that in anatomy, If there is a more specific answer, the general answer is wrong. So for instance, if I made a quiz question and I showed you this plane of section, and I said, identify this plane of section, yeah? And then I gave you all of these choices. I said longitudinal, I said vertical, I said sagittal, mid-sagittal, and parasagittal. There's only one correct answer there. What is it? Parasagittal, yes. And you get 0 credit in anatomy for giving a more general answer when you could have given a more specific answer. And that may seem arbitrary, but please do remember that you are going to be in charge of human health. And being specific is often a life-saving technique, right? So if there is a more specific answer, the general answer is wrong. Okay? All right. So mid-sagittal, parasagittal. Okay. And then the next one that we're going to talk about is this one, which is a transverse or horizontal plane of section, also sometimes called a cross section. And the transverse plane of section divides the body into what and what parts? Superior and inferior, or use a different set of terms? Cranial and caudal. Good. Okay. And there is no mid-transverse plane either, because although this seems like it would be a midline, there's no mirror image structures here to here. So you can just have any transverse plane of section you want to see there. Good? Okay, so transverse plane. All right, so, and then the last plane of section is generally an accident, but it doesn't mean that you couldn't use it. Oblique plane of section goes not parallel and not perpendicular to the long axis, but at some other angle. It's called oblique. And it usually happens because you tried to get one or the other and you just kind of missed it. But it doesn't mean that you can't use it. You totally can, and you see those all the time in histology. Can you imagine that if I had a super duper curvy tube, really curvy tube, and I did one slice through it, I would probably get all 3 on the same histology slide, right? I'd get a longitudinal section of maybe a tube. So I've got a super curvy tube, imagine, and I make one slice through it. Can you imagine I might get a cross section, a longitudinal section, and an oblique section on the same slide, right? Okay, so let's practice that just a little bit. Okay, so this is something that I am bad at, which is why I wrote this. Some of you guys are so good at it that this will seem really obvious. One of my weaknesses as far as intelligence is that I have a very, very hard time taking a 3-dimensional structure and knowing what it will look like if you rotate it in space. Is anybody else really bad at that? I'm super bad at that. Interestingly, women tend to be worse at that than men. And it's not because of genetics. I think it's probably because of environmental reinforcement. And you can actually make yourself better at it. You can play first-person shooter games. They make you get really good at turning things around in space. And that's exactly why I play Borderlands with my 12-year-old, just because it's fun. And everybody in my whole family kills me because I can't do this. So take the 3-dimensional structure and imagine what's going to happen. So with this, what we're going to do is we're going to imagine a 3-dimensional structure that you're going to run into all damn time in the body, a tube. Boatloads of tubes in there. I want it to be an empty tube, okay? So imagine we've got the human esophagus, right? Relatively straight, okay? And what I want to do is I want to cut it so that I can see what's inside the tube, hopefully nothing. And then the tissue that makes up the tube, and I can look at it under a microscope, okay? So all I'm asking you guys to do is to imagine this tube and imagine cutting it and tell me what the cut edge is going to look like with 3 different planes of section, okay? So I'm going to be looking at a histology slide. And you guys know that with slides, there's so much crap on there that is not relevant to what you're trying to accomplish. Half of the battle is knowing not to look at your eyelashes for 25 minutes, right? And knowing which part of the slide is actually relevant. So this is getting you your prediction as to what is relevant. So first thing I'm going to do is I'm going to do a longitudinal section of this empty tube. And what I'm really interested in is what do the cut edges look like when I put them on the slide. So I take a single slice and I'm going to put it on the slide. And there's going to be a bunch of distracting crap that is not interesting to me at all here. And what structures, what shapes am I going to look for on that slide that tell me I'm looking at a longitudinal section of a tube? Go ahead. Oh, it doesn't matter, it's wrong. Part of the learning process.
So you're going to cut it straight up and down.
Straight up and down, exactly.
So you're going to probably see like
Yeah, except
So
that you need a single slice straight up and
you're
down.
doing a single slice.
Yeah, I'm doing a single slice straight up and down. Because with histology, you want something thin enough that you can see through it, right? So what am I going to see? You're not going to see the back of it. I wasn't trying to get that. I'm going to get two parallel lines. If the tube is empty, it's going to be white lumen right here, white space, right? And if I'm looking at the tube, right, the tissue that makes up the tube, what I'm going to end up having is the tissue will be bordering this white space as two parallel lines. Yeah? And then I'm only interested in the tissue that is right next to the white space, right? That's a longitudinal section. Now, if you have a tube, do you have a frontal section or a coronal section? No, because it doesn't have a midline. So you just call it a long section. So if I had, for instance, a slide and I was looking at it and it said human esophagus, comma, L dot, S dot, my expectation is to look for two parallel lines around the blank space. All right? Now that you got that, tell me what it would be if I looked at the same organ but in a different section. This time I want to look at a cross section or a transverse section of the human esophagus. What's my expectation as to what to look for on the slide? Human esophagus, comma, X dot, S dot, or C dot, S dot?
Would it be a circle?
Circle, exactly. Same tissue, right? Different slides to look at it. So we'd have a circle, white space right here, right? And the tissue that I would be interested in would be the tissue that is bordering the white space. This is the tissue that is forming the esophagus, yeah? Okay, one last. Now, if it's a curvy tube, you're going to get an oblique section. So what if I tried to get a cross section and missed it slightly? What shape would I see on the slide? Oval, exactly. Yeah. And again, if you had a curvy tube and sliced it, like if you went straight through a super duper curvy tube like the small intestine, you'd get all of the sections. You'd get all of them with one big slice. Good? Okay, so you are going to start seeing that this week when you start looking at histology in lab. Let me show you a histology picture real quick. I didn't pull this up for you, but I want to show it to you. Okay. Tell me what type of section that is. Oblique. They probably tried to get a transverse section, but they kind of missed it. Let's see if you can do another one. What about this one? That's a longitudinal section, right? They just happen to catch the end of the tube, but it's a longitudinal section. Do you see? Okay. That's why there's two, right? Okay. It's not a straight tube, but it's a longitudinal section of a curvy tube. Good. One more, and then I'll leave you guys alone. Well, I won't actually, but. I'll show you my favorite tissue because I'm a nerd. I have a favorite tissue because it's cute. What kind of section? That's a longitudinal section. Yeah. Good. Okay. All right. So now you're going to run into that a whole bunch this semester, a bunch of different kinds of sections. Some people, the reason I'm telling you that it's the same tissue is because if you memorize a single slide of simple cuboidal epithelium that looks like this, that's silly because you could just as easily cut the same damn tube like that or like that, and it's the same tissue. So try very hard to avoid rote memorization. Don't do what the weak students do in lab and only memorize those histology pictures in the packet. Because me, I will never ask you the ones from the packet, okay? And when I taught lab, I never did either. You expose yourself to multiple iterations of the same thing, and then you start to recognize the commonalities between the different pictures, okay? All right, so now we're going to change gears just a little bit, and we're going to talk about body cavities and membranes. Okay, so with body cavities and membranes, what we're going to be talking about is the places inside the body where you keep your squishy organs. So let's talk about those. Okay, so when you're talking about body cavities and membranes, so we have a whole bunch of squishy organs and we need a place to put them. Those are called body cavities. we have two big divisions of our body cavities. We have the body cavities that are from here to here. And this is all one big body cavity. It contains all of those squishy organs. Collectively, these are all in what we call the ventral body cavity, because it's ventral. Yeah? And then the other body cavities are the ones that go like this. They are right here to right here, and they contain your brain down to your spinal cord. And those are called the dorsal body cavities, or sometimes they refer to them as the posterior aspect. I don't use that, but your textbook uses it. Now, why dorsal? Because on me, this doesn't look very dorsal. But remember that I'm the exception, not the rule, and think about my dog. Is that a dorsal body cavity for my dog? Yeah. Okay, good. Okay, so let's divide the dorsal body cavity into its two subcomponents. The dorsal body cavity contains two organs, the brain and the spinal cord. Yeah. But then you can be specific. The part of the dorsal body cavity that contains the brain is called the cranial cavity. And the part that contains the spinal cord is called the vertebral or spinal cavity. Good? Okay, so let me reiterate again that if there is a more specific answer, then the general answer is wrong. So if I said, which body cavity contains the brain, and gave you to choose from dorsal, ventral, cranial, vertebral, then there's only one correct answer, right? It's cranial, right? Okay. If you are using a general term, make sure I'm pulling it out of you kicking and screaming, because nothing else is correct to say. Okay? All right. So now let's do the harder one, and the harder one is on this side. The ventral body cavity is harder because it has a bunch of subdivisions that you have to actually understand. And make sure that you ask if you get confused, because people do get confused about this one.
So you said the cavity, it just has fluid stuff surrounding it, because you said on that, what was it, the mediastinum?
We haven't talked about that yet. Shh, be quiet. Okay. There's a method to my madness. I give it to you when you're ready for it. Okay. All right. So the ventral body cavity is this big body cavity from here to here, and it contains everything from like your lungs and your trachea all the way down to your urinary bladder. That's all ventral body cavity. It has an immediate, obvious subdivision, which is this big bell-shaped skeletal muscle right here, which is called the what? Yeah, the diaphragm, which is spelled diaphragm. There's your diaphragm. It's a skeletal muscle and it's bell-shaped, and it almost completely divides the top from the bottom. It has tubes that go through it, but it's pretty much complete division. Everything superior to the diaphragm in the ventral body cavity is considered in the thoracic cavity, and thoracic means what? Chest. Yeah. Okay. And everything inferior to the diaphragm is in the abdominopelvic cavity. Yeah. Abdominopelvic. Good? Okay, so thoracic and abdominopelvic. All right, now let's practice that again. Which body cavity, without even telling you anything special about it, which body cavity contains both lungs and the heart? Thoracic. Which body cavity contains both lungs and the urinary bladder? Ventral. Do you see? Pulling it out of you, kicking and screaming because there's nothing else true, right? Does that make sense? Okay. So now what we need to do is we need to subdivide this one. And this is where you need to pay attention because this gets confusing, and that's what she was asking about. Okay. So the thoracic cavity has further subdivisions. Okay. So pay attention and ask questions if you get confused here. The thoracic cavity has within it 3 other body cavities, 1, 2, 3, and then a space. So I'll tell you about the space in just a second. Okay, so the thoracic cavity can be further subdivided into a cavity that contains the right lung, which is called the right pleural cavity. P-L-E-U means air, common prefix used for lungs. Okay, the left pleural cavity, which contains the left lung. Okay, and then the pericardial cavity, which contains the heart. Yeah. Okay, so I'm going to draw it really generally first, and then we'll get more specific as we get better at this. Okay, so whole ventral body cavity diaphragm. Yeah? Okay. So what we are going to have is we're going to have a cavity over here that contains a lung, and This is going to be the left pleural cavity, right? Cavity over here that contains the right lung, and that's going to be the right pleural cavity. And then I'm going to have a separate cavity for the heart. The heart is weird because it actually brings its own bag. It brings a cavity with it. I'll explain that to you a little bit more later. The heart actually has a sac that is surrounding the heart, and the sac creates a space for the heart. So what I'm going to have is the heart sitting in here with a bunch of its tubes running through it, okay? But it's going to bring its own bag. It's going to BYOB. And that's going to create its little cavity. It doesn't go below the diaphragm, though. Okay, does that make sense? So, right pleural cavity, left pleural cavity, pericardial cavity between. Okay, now, the thing that she's asking about, I need you to visualize for me. You ready? Okay. The left pleural cavity and the right pleural cavity, before I put the heart in, have a space between the two cavities, okay? Do you see this space between the two cavities that doesn't actually have like a wall of its own? That space is not a body cavity because it doesn't have an actual membrane of its own. I'll talk about the membranes in just a second. It is a space between cavities called the mediastinum. Will you say that, please? Mediastinum. Okay, so what is in the mediastinum other than the heart with its own little sac? Well, there's tubes running through there, right? You got the trachea, you got the esophagus, you got a bunch of blood vessels like the aorta running through there, right? So there's a bunch of stuff in there, but it's between the two body cavities. That makes sense? And then anterior to all of that, you got my tubes running. Then I'm going to put the heart in its pericardial cavity in there. That makes sense? So this figure in your textbook is trying to show you that, but they didn't show you what it looks like without the heart. So imagine this picture before they put the heart in. I would have right lung over here, left lung over here, right? Take the heart out. The mediastinum is yellow. It would be yellow all the way down to the diaphragm. And then I would put the heart in the pericardial cavity in there. That good? Okay, so I'm going to give you two statements. I want you to tell me which one's true, okay? Statement A, the heart and pericardial cavity is contained within the mediastinum. Or statement B, the mediastinum is contained within the heart and the pericardial cavity. The first one, A, is true, right? And the mediastinum is only within one body cavity. Which one? Thoracic. It's only within the thoracic cavity. Does that make sense?
Can you say that first statement again?
The heart and pericardial cavity are within the mediastinum. Yes? Does that make sense? Okay. Got it? Okay. So the mediastinum is really a space between cavities, and we will see how the cavities are formed once we learn the membranes that are forming them. Okay. So you got it? All right. So now we need to move down, and we move down to the abdominopelvic cavity. And the abdominopelvic cavity is containing all of the organs below the diaphragm, all the way down to the urinary bladder. Okay, but it has a subdivision too, and the subdivision is easy on that one. The subdivision is just abdominal and then pelvic. Okay, now in humans, there isn't a clear division like a membrane to mark the border between the abdominal and pelvic cavity, but in lots of mammals there is. There is not in us and a lot of other primates, but in lots of other mammals, there's actually a membrane right there. So how do we know in us where it is? We use these landmarks, the anterior superior iliac spine, draw a line, and everything below that is in the pelvic cavity, and everything above it is in the abdominal cavity. So there isn't a whole hell of a lot in there. But what organ is pretty dependably going to be in there? Urinary bladder, maybe the distal end of your large intestine and rectum on its way out, right? Your ovaries aren't even in there, ladies. They're up there, okay? So, what kinds of organs are in your abdominal cavity? Stomach, the entire small intestine, the vast majority of the large intestine, right? Liver, kidneys aren't because for a reason. What?
Is the gallbladder in there?
Yeah, gallbladder is in the abdominal cavity. Okay, so you will have to, for each of these body cavities, 1, 2, 3, 4, 5, you'll have to tell me an organ that's in each one. It is not hard. Okay? Which body cavity, or tell me an organ that's in this body cavity. Wrong. Left one. Yes. Okay? Right one. Heart. Now, choose one that's really freaking easy and could not be true in a normal anatomical human that's in the abdominal cavity. Stomach. Liver. Right? If you go out on a limb in anatomy, make sure it will hold you. Because if you put something that is only true-ish, I will count it wrong. Okay? So don't go rummaging down there in the large intestine, right? Because some of that goes down here. What's the safest organ to put for pelvic cavity? Urinary bladder. Yeah, that's the safest organ to put. Got it? Okay, cool. So, now, the body cavities, the dorsal and ventral, are kind of different from one another, and that does have an impact on animal behavior. So, you're an animal. Your dog's an animal. If your dog feels physically threatened, is there anything that they do with their body to protect the most vulnerable of the body cavities? What does your dog do? Somebody tries to attack it. What? They lower themselves, or they put themselves in the fetal position. Why? Because you don't like your brain. You totally love your brain because it's the thing that loves things. Okay? But it's got a really good case on it, doesn't it? It's really hard to crack it on accident. Those of us who are parents know that your kids actually fall on their damn head all the time and it doesn't crack open. It's amazing. It's funny. I say this every time. How many of you guys are parents? Okay, so the people who have not had children, they always look horrified when I say that. Oh my God, you're dropping your children on their head? Like you have been dropped on your head. Children are very, very wiggly, and they're constantly secreting something. So they're like super moist, and they're squirt out of your hands. Yeah, and they survive. Every single parent among us thinks they're going to get taken away by Child Protective Services, but they're still with us, so we're fine.
The first one you jump.
I know. And then later on, you're like, you're fine. Brush it off. So, humans also do this, both when they're physically threatened and also when you feel so damn emotionally threatened. Have you ever gotten like in such a bad mental state that you're in the fetal position? Mm-hmm. If you haven't, you've lived a really, really privileged life. You're like under the covers in the fetal position, waiting for somebody to bring you a cocktail. My husband brings me champagne and chocolate until I come out. So yes, humans do it as well. Okay, so now we are going to go to the things that form the boundaries of these cavities. So you can't really have a distinct cavity unless you have a boundary. So now let me teach you a little bit about the boundaries. So the boundaries are called membranes, and specifically they're called serous membranes. Serous means watery. The job of these membranes is creating a boundary that is lubricated. So they are going to lubricate the organs. So the serous or watery membranes are also called serosa, and it's a thin sheet of membrane. It's found only in the ventral body cavities. The dorsal ones have separate membranes. I don't know if you've heard about meningitis and meninges with the brain, but we'll do that when we get to the nervous system. But if you're talking about the ventral body cavity, let's talk about how these membranes work. So I'm going to draw just a general picture of any body cavity, and then we'll look at how the membranes work, and then we'll apply it to specific body cavities. Okay, so, all right. So this is any body cavity, any of the ones that we just talked about. It doesn't matter which one, okay? So this is a cavity. And then we're going to have an organ that's sitting in the cavity, right? Doesn't matter which organ, okay? So what I'm going to talk about is how the membranes sort of form and line the cavity. All right, so what I want you to imagine is that you have a Pyrex dish, which is your body cavity, right? And you have the most precious sandwich in the history of the world that needs extra loving wrapping, like it's a Moochie's meatball sandwich. You know how amazing those are. If you haven't had them, you need to do that with your wife. Okay, so you've got a Pyrex dish, and you've got the sandwich, and I'm going to wrap the hell out of the sandwich. I'm going to make sure that it's protected properly. And I'm going to do it with that crystal pink saran wrap so that you can see it. So what I'm going to do is, unusually, I'm going to take the crystal pink saran wrap and I'm going to wrap the entire body cavity, right, first. empty, right? I'm going to take the same sheet, never cut it, and I'm going to wrap it around the sandwich, yeah? And I'm going to put it in the dish. So my question to you is, between the sandwich and the Pyrex dish, how many layers of saran wrap are there? Between the bottom of the sandwich and the Pyrex dish? There's 2, right? So there are always going to be 2 layers. And in you, those 2 layers are going to be really important, because your sandwiches are organs and your organs are wiggly. And these 2 layers are both secreting lubricating fluid so that you can slide the organ past the body wall. So here's how it's going to work. Here's my organ, right? Here is my Pyrex dish. I'm going to wrap the whole thing. It's stuck to the wall, but you wouldn't be able to see it if you're on the wall. Okay? Same sheet is going to fold down, wrap around the organ, fold back up, and suspend the organ from the body wall. So now, not only is it lubricating, so if this organ is super wiggly, like heart or lung, okay, as it moves, lubrication between the wall and the organ, right? In addition, why does your stomach never end up below your urinary bladder? Because it's suspended from the body wall by that little piece right there, which keeps it in position. Does that make sense? Okay, so last thing about this is just that the sheet, the serous membrane, has a different name to describe it when it's stuck to the organ and when it's stuck to the body wall. So the serous membrane that is stuck to the organ is called the visceral serous membrane. Visceral means guts. The serous membrane that is stuck to the organ is the reason why if you cut yourself open or a deer open or a chicken open, the organs are shiny. Why are they shiny? Because they have a clear, lubricated serous membrane on the surface of the organ, right? That's why they're shiny, okay? And then this portion right here, that is not stuck to the organ, but is stuck to or forming the body wall, is called the parietal serous membrane. Can you say parietal, please? Parietal. Okay, parietal. So, let me give you an example of this. You ready? I'm going to imagine cutting myself open. And you're going to tell me whether I'm touching a visceral or parietal membrane. So I'm going to slice myself open, okay? And I'm going to touch the shiny anterior surface of my liver. Which serous membrane portion am I touching? Visceral. I'm going to slice myself open, and I'm going to touch the body wall that is just anterior to my liver. And then I am touching the parietal serous membrane, right? If I slice myself open in the thoracic cavity and open up my right pleural cavity and touch my right lung, I am touching what? Visceral or parietal? Visceral, right? Even though it's all one sheet, right? You're describing which portion of the sheet you're talking about. Okay. Last thing is, just let me tell you guys, I won't quiz you on this at all, that there are actually different sheets, and the sheet actually gives you the boundaries of the body, of the cavity. So I'm not going to quiz you on this, but the reason this is a separate cavity is because it has its own sheet, yeah? And the sheet that is wrapping this one is called the left pleura. Pleura is the name of the sheet. You've got another sheet over here that makes a separate body cavity. That's why, by the way, guys, these body cavities are separate, so you can collapse one lung and the other one will still work. The pericardial cavity has its own sheet. Remember, it brought its own bag? Okay. And then this whole area down here has one big convoluted curvy sheet. So this is a pleura, this is a pleura, this is a pericardium. This whole sheet down here, and we're going to do this next time and you won't be quizzed on it yet. The whole sheet down there is called the peritoneum. And so last thing, if I touch my liver, now I could be more specific. I could say I was touching my visceral peritoneum. If I touched the wall around my liver, I was touching my, you can do it, parietal peritoneum. Exactly. That makes sense? Okay. So these are adjectives. I was just telling you the nouns that go with them, and then we'll practice the nouns next time. Okay? All right, so I will see you guys on Wednesday. You have a quiz over the prefix roots and suffixes and everything down to visceral and parietal. Okay? Cool.
I like